Hey, this is Dr. Ganjami, the Sock Doc, and in this video I want to talk a little bit more about the hamstrings. We talked about it somewhat in the knee video that was put out a while back, but the hamstrings are a very commonly injured muscle. A lot of times people pull their hamstring, they end up with sore hamstrings after working out, even after running or playing a hard basketball game over the weekend. But actually I see the hamstrings not need to be treated as much as I do the other parts of the back of the leg there. In other words, the glute max, your butt muscle, and your calf muscles, your gastroc and your soleus. So the whole kinetic chain often is off in the back of the leg, the balance between your glute max, your hamstrings, and your calf to drive you forward and give you propulsion and pushing yourself forward, whether you're running up a hill, cycling hard, or kicking hard, or whatever you're doing. So let's talk just a little bit about what you can do. With the hamstring, obviously your hamstring starts in the back of what's called your ischial tuberosity, which is your sit bone. And if you put your hand right on the back of your butt there, you can feel that bone, and that's where all three of your hamstring muscles start. And then they come down and they attach to either side of your knee, two on the inside and one on the outside. We're not going to get into those names right now, but basically what I want you to do is, if you notice that with your leg bent like this, that you're feeling some discomfort or tightness there, that's probably going to be more of your hamstring. Now if you start way down here and just bend it a little bit and you feel it out like this, with your leg extended, that might be more glute max. And in here, with your hamstring like this, a slight little bend, you actually might be influencing the calf a little bit more. So hamstring, think more neutral and a curl here. But at the bottom, when you start to bend your leg, that's more calf. So this is more calf here at the very bottom, even though you're using both muscles. But as you come up more, that's more hamstring. And if you extend back and curl a little bit more, you're going to be using both the hamstrings and the glute max, because your glute max is going to push you back like this, okay? Now the other thing where you're going to get more gastroc action is if your foot is dorsiflexed, like so. So my toes are pointed down. So this is going to be more hamstring, like this motion here, and then gastroc here, like this. So in other words, if you're feeling more pain in this direction here, this motion, think more gastroc calf. Here, think more hamstring, okay? So glute max, hamstring, gastroc, way down here, the start of the flexion, that's more gastroc. The other muscle, of course, in your calf, soleus, that's more tippy toe, more pushing off on your toes, propelling you forward. That's down there. Hamstring, origin insertions, again, you might find a tender spot, a trigger point. The origin of the hamstrings right up in your ischial tuberosity. So if you're feeling pain here, you can actually touch that area and move your leg like I just showed you. If that relieves some of the discomfort, work that trigger point out like we talk about in the trigger point video and the articles. You can also just assess yourself and work your hand down the belly of the hamstring and the back of the thigh here. Remember, the glute max is going to come in there too and connect with your iliotibial band to go on the outside of your knee. Put the hamstring in here, look for any tender spots. One of the hamstrings attaching to the outside of your fibula here, the bone on the outside of your lower leg, and the other two on the inside of your tibia, the inside bone there of your lower leg. So you can look for tender spots in there. Again, hold them like that. You can do that, sort of grab your lower leg, flex like this. You're going to need good balance on that opposite leg, or you can even do it seated if it hurts enough. It's like that. Or, as I said earlier, more commonly, you're going to be dealing with more calf issues. Those are much more common in what I see with athletes than actually hamstring issues. You might have a hamstring sore muscle, or even pull your hamstring a little bit, but most often the calf is the one that needs to be treated. Those calf muscles come up and they actually connect with your femur, your big thigh bone, and therefore those trigger points are going to be in here, right above the crease of your knee, on the inside and the outside, the medial and lateral parts of your knee. So again, that's this motion here, foot flex, or the start of the flexion of the lower leg, and dorsiflexed foot. You can feel them right in there, and you might have to rub those trigger points. You can rub them for a second. Hey, that feels better. You've got more of a calf issue, okay? Let's talk quickly about a couple really good exercises for rehabilitation, or even just strengthening your hamstrings, other than just obviously natural movement of running and walking. One that I like to do a lot is a straight leg deadlift, a single leg deadlift actually. So you can use a kettlebell for this, or if you're not used to that and you don't have someone to show you proper technique with a kettlebell, you can obviously learn that from somebody who knows what they're doing, or just start doing by body weight, where one leg is planted down, in this case my right leg, and my back leg is nice and straight. I've got a nice straight back. my lumbar spine is nice and straight and strong. I'm stable, and I'm coming forward like this. Back and forth, just like this. Nice straight and solid lower back. So when you're looking at me from the front, my shoulders are staying square to you, and I pick up the kettlebell right there. I'll show you on the side. That kettlebell is right between my right foot, starting right next to my right foot. Coming down like this, nice straight back. I'm lifting up, and then you can even put that opposite foot down. And I'm staying nice and strong, nice and stable. Coming back just like that. From the opposite side. Now my left leg, it's right next to the kettlebell. Nice and square. Coming down, nice straight back, nice square shoulders. Up like that, and back down. Just like that. Notice how my knee is bent. I'm not dropping it like this. It's just a slight bend in my knee. And this hip stays back, this right leg extended. Nice and strong and solid. Right back up, like that. Those are great exercises to do. Really a good thing to work on your balance too with those. And the second exercise is a squat. And I talk about this in the natural flexibility article on the SockDoc site. But a squat, ideally, you want your heels to stay on the ground and go as low as you can without extending your body too far forward. So you're trying to stay as vertical as possible, your shoulders over your hips, just like that. And ideally, if you can get down and sit in that squatted position, that's where you want to be, and work on your stability here without swaying in either direction. You can also grab a pole or have somebody hold you if you're trying to tip back because you're not used to the balance. Your arms are nice and relaxed. Stay here as long as you can. Again, the heels stay down. So if I only can go to here before my hips start to come up, and right now, just start with that. Come down like this. If you're already good at a squat, or if you want to develop some more strength in your lower legs and your core, your abs and your back, grab a kettlebell. Any weight will do. You're holding it right here, and you're driving up with it. So you're nice and strong like this. I'm not leaning forward. I'm hip hinging a little bit with my lower back. My knees are bent slightly to start, and I'm coming down straight like that. My elbows are touching the top of my knees, and I'm driving straight up like that. From the front, like this, my butt's out, kettlebell stays strong. I'm not resting this here, I'm just touching, and I drive straight up. So I'm not doing this. See the difference? Leaning forward, my shoulders, I want to be straight up and down. Just like that. Great way to help your glute max, strengthen your glute max, rehab your glute max, do the amount of weight you can do, couple sets, 10 reps, you can do it. If you can't, lower the weight a little bit. Don't want to be too sore the next day or you overdid the action the first time. Take your time doing it, and it's a great way to rehab the lower leg muscles, glute max, hamstrings, that sort of thing. Good luck.